Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. This channel is for the students, for the professors, for the doctors, for the patients, and also for the common man. In this channel, you will find some videos in the Marathi language, Hindi language, and English language also. So, Ankit, I request that you can close your mic if it is possible. Video and mic both. Okay, good. Thank you. So today we are having a lecture of Swasthavritta subject for the second or third year BMS students. But although lecture is for the students, this lecture will make a more knowledge to the common man also. And especially doctors also should take cognizance of these lectures because it is we are discussing today two important diseases if possible. If we complete one, that is okay. Cholera we are going to discuss, and second we will discuss the typhoid. This is the Swasthavritta subject. Kindly open your notebooks. Make 11th of February 2024. Please write down the topic epidemiology. Today we are discussing Swasthavritta subject paper 2. Swasthavritta subject, please write down paper 2. And in paper 2, there are important 17 points. I will repeat, syllabus point. One should always remember the syllabus and the question bank. Okay, these are the key, very interesting things for success in examination. Syllabus, question bank, syllabus, question bank. So these are the points for paper 2, part A, that is Samajika Swasthavritta. In the modern allopathy, they say preventive and social medicine, PSM. So 17 points. Janapada Dhunsa, number 1. Second, Vayu or the air. Third, Jala or the water. Fourth, Bhumi and Nivasasthan, land and housing. Fifth, Prakash, that is lighting. Sixth, Dhvani Pradushana or noise pollution. Seventh, Vikirana, that is radiation. Eighth, Apadravya Nirmulana, that is disposal of solid waste. Ninth, Malanishkasana Vyavastha, that is excreta disposal. 10th, Shava Vinasha, disposal of the dead body. 11th, Rutu Evam Vatavarana Jnanam, that is meteorology. 12th, disaster management. 13, occupational health. 14, school health services. 15, today's topic, epidemiology. Please write down epidemiology, today's topic. There are nearly 10, 15, 20 diseases, but we are taking only important diseases. Epidemiology. Will you please write down EPI, epidemiology. I will tell you what is epidemiology. Okay. Then non-communicable disease epidemiology. Non-communicable. That means they will not transfer from one person to another. Okay. And 17th, Chikitsalaya Bhavana, that is hospital bedding. Okay. So these are the topics. Swasthavritta, paper 2, part A. Now, what is epidemiological study concept? Epidemiology is a study of population, society, people in the Maharashtra, people in the Gokhale Nagar, study of these people. For what? Frequency, to determine the frequency and distribution of diseases. How much frequently my whole area, Kapila society, is getting the problem of cholera in the rainy season? How much is the cases of the jaundice? So I am studying the population. I am studying the population, that is epidemiology, for the frequency and distribution of disease. Number 2, what is my purpose? Measure the risk of these diseases. How many people will be in danger? And this epidemiology science is dealing with transmission and the most important, control of disease. We have to control. We have to control the cholera. We have to control the typhoid, because sathiche azar, communicable diseases, samsargajanya vyadhi, from one person to another, epidemiology, cholera. Now, cholera in Ayurveda, it is called as please write down Visuchika. Yes, write down Visuchika. Cholera, Visuchika. This is digestive system problem, infection, and loose motion, and also sometimes vomiting. Loose motion and vomiting, cholera. Okay, choleraची 7 epidemic disease. So this is the acute diarrhea. Till yesterday I was all right, and from today morning till at this 11 o'clock I have to rush to the toilet for 5, 6, 7 times. That is called as acute diarrhea. And the organism is Vibrio, V. cholerae, Vibrio cholerae, Vibrio cholerae, name of the organism. This is very important for the AIA PGET, entrance examination. So I am also, while teaching the UG, I am giving you some points for AIA PGET, entrance examination, all India level. So many pandemics, many people suffer. Pandemic means lot of population is suffering in the 19th century. And then this particular disease also spread to the Western countries. In 1961, seventh pandemic began in Indonesia. Cholera is an epidemic and endemic disease. Please write down epidemic and endemic disease. Okay. So now we will see the details of Vibrio cholera. These particular organisms, we can prevent cholera because these microorganisms can be killed only in 30 minutes by heating and within few seconds by boiling. You must drink boiled water. You must drink boiled water whenever there is a epidemic of cholera. Rainy season is the most dangerous. Drying and sunshine will take the few hours to kill them. Vibrio cholerae remain in ice for more than 6 weeks. OMG, oh my God. That is why in the summer season, you don't drink sugar cane juice with ice. Dangerous, dangerous, because we don't know in the Gurhal where the sugar cane juice is given, from where they are bringing ice. We are not sure. It may be from polluted water which contains Vibrio cholerae. That is why we doctors always advise you can drink sugar cane juice, but in clean and hygienic places. There should not be flies. There should not be ice prepared from the bad water. Better way, you don't drink the sugar cane juice without ice, because you can see that 6 weeks they are Vibrio cholerae inside the ice. Human is a reservoir and also carrier. It can transmit the disease from one person to another. Carriers are detected by bacteriological examination of purged stool. So stool examination in the laboratory is the most important to diagnose these cases. Okay. Immediate source of infection is stool and also sometimes vomit of the patient and carriers. Huge number of reservoirs, vibrios, are present in the watery stool. Remember, whenever the patient is having loose motions, be careful. Okay. A case of cholera is infectious for 7 to 10 days. Convalescent carriers are infectious even for 3 weeks. So they are carriers. They are still have the disease is controlled, but they have organisms in their stool. A cholera carrier is a healthy person who is still excreting Vibrio cholerae organisms. Incubation period of cholera 1 to 5 days. That means you have to ask the history. If the cholera patient comes to you in the dispensary, whether you have traveled outside in the last week, whether you have drank that sugarcane juice with ice in the last 6 days, that can give you the idea. He has got cholera from that ice. Okay, now we will go further about the cholera. We are discussing about the cholera, my dear friends. So here, gender and age are no barriers. Male, female, anybody can be affected. Child of 5 years, 10 years, young person of 25 years, old person of 60, 70 years, anybody can get affected. In endemic area, children are more affected. Pilgrimages, very dangerous place. Pilgrimages, fairs, festivals, marriages, lot of crowd. We don't know who is the patient. And then they go to the latrine, there they do the stools, and then flies are there, unclean atmosphere is there, and the disease starts spreading. Disease occurs in maximum in poor socio-economic group. Why? Because poor hygiene. They don't have the Dettol. They don't have the soap to clean their hands. And they also, crowded houses are there, crowded people are there. And that is why the problem is improper ventilation, cleanliness is a problem, hygiene is a problem. Natural infection gives good immunity. Vaccination gives temporary and partial immunity for 6 months. Yes, vaccination can be done. Transmission occurs through the contaminated water and food. These things are very important. So don't eat outside in the rainy season. Don't eat outside with the open. It should be covered one. Whatever you are eating, bhaji, pav, anything, noodles. When you are eating outside, take precaution whether the surrounding is clean or all the the sand is there, water is there, mud is there, flies are there. Oh my God, it's bad. Okay. Flies can also carry Vibrio cholerae, some bad habits, and I will go on the next page slowly and steadily. So we will try to go the next page. Some bad habits. And just, I would like to go on the next page. Okay. So here you can see next page and try to control the situation. Nowadays, mortality rate, that means the people having the death, has come down. Don't worry. 1% only because of the rehydration program. The most important is give the water, boiled water. Boiling water for 20 minutes will kill the organisms, and that after boiling, cool it on the room temperature and drink with addition of the little bit salt, little bit sugar, little bit of lemon juice. You can prepare ORS, oral rehydration solution, at your home without any much money. If you want to go outside and purchase, electral powder is available in the pharmaceutical shops, and that also you can mix with the water and drink that water. So in spite of going to the hospital, saline, you can do the rehydration program at your home. In cholera, antibiotic should be given when vomiting stops. This is important because if the vomiting is going on, the medicine will come out after 3 to 4 hours of oral rehydration. What is the medicine? Tablet Bactrim DS. One morning, one evening for 3 days, or tablet furazolidine. Morning, afternoon, evening, night, 4 times. QID means 4 times, minimum 3 days. So I will wait. Please write down these medicines. Bactrim, you write down this ORS. The word is ORS. You can write down this Bactrim DS, morning, evening, that is BD, and furazolidine 4 times. QID means 4 times. Also, there must be advice for sanitation. Some institutes can assist in investigating outbreaks. That means they will decide and declare National Institute of Communicable Diseases. This is because we are talking about epidemiology. We are talking about Swasthavritta subject. So it is not a medicine only. Some people will say, okay, I understand this disease. No. You have to write down the name of the institution. National Institute of Communicable Diseases, New Delhi. Okay. Now next. As water is an important vehicle for transmission, in rural areas, water can be made safe by boiling. Number one method is boiling or chlorination, mixing chlorine in the water. That is a purificating agent. Okay. Education should be given to use the sanitary latrines, not to sit the children outside on the road for the latrine. Now the Sulabha Shauchalaya, the present Prime Minister Modi Sarkar, Swachhata Abhiyan, and they have constructed different latrines and urinals at the different places. So use those sanitary latrines and not depositing feces in the open ground or near the water. Hand washing with soap after defecation must. You have to wash the hands. Eating cooked hot food. This is very important, and not the stale food. Cooked and hot food, not to eat the food which is kept open or uncovered. And proper food handling. The person who is delivering you the vada pav, you should see whether he has any skin disease, the nails are over, his hands are not clean. Always better in the good shops, they wear the hand gloves, plastic hand gloves or the very thin hand gloves, and they serve to the people. That is the right method. Okay. Next is a chemoprophylaxis. We will discuss chemoprophylaxis. That means with the medicines, you can prevent the disease. Chemoprophylaxis, we are discussing cholera, visuchica, loose motions. This prophylaxis that in my society, the lot of people are suffering from cholera, and I don't want to get cholera. What I can do? Okay. This is only for household contacts or the closed community. Suppose my father is suffering from cholera, okay, and I don't want to get the cholera. Then what I should do? Capsule tetracycline. Please write down the name. Prophylaxis with medicine is called as a chemoprophylaxis. Okay, so this is tetracycline, 500 milligram morning and evening for 3 days for adults. Prevention is always better than cure. How else you can prevent? Vaccination. Till these days, cholera vaccine was the only specific prophylactic available protective value, 50% for 3 to 6 months. In some countries, oral vaccine is given in 2 doses, having a gap of 15 days. So this oral vaccine also gives 60% protection for 3 years in the European countries. But in here, India, we can get the vaccine. Most effective prophylactic measure is health education for the cleanliness, number 1, and oral rehydration, ORS. This is the main part of diarrheal disease program, control program, diarrhea disease control program. Please write down diarrhea disease control program. Okay. Now this is about the rehydration. We are discussing now about the rehydration, ORS. The rehydration can be oral or intravenous, saline. The main aim, why we are doing the rehydration, oral fluid therapy is to prevent dehydration and reduce the death. Mortality is a death. Person dies not because of the Vibrio cholerae. Person dies because of dehydration. Water is lost. That is called rasakshaya in Ayurveda. We give the Laja Manda. Please write down Laja Manda, Ayurvedic treatment. Okay. At first, the composition of ORS is recommended by WHO. What was that recipe? Sodium bicarb based, which is then replaced by triasodium citrate. Triasodium citrate made the product more stable and resulted in less stool output as it increases. Because of this triasodium citrate, the intestinal absorption of sodium and water. Next is intravenous, IV, usually required in severely 3rd degree dehydration who are in shock. You know the shock, hypovolumic shock. Water is lost and brain gets, because then blood volume will be less and less blood supply to the brain, that is shock, unable to drink. The solution recommended by WHO is a Ringer lactate. This word is very important. Ringer lactate solution. If nothing else, infectious as long as bacilli, I'm sorry, I think I have missed something. I will just check it out. Okay. Intravenous rehydration that we have seen. And then we will go further to check it out. Yes. So this disease is infectious as long as bacilli appears in the stool and urine. Carriers may be temporary or chronic. Convalescence excretes the bacilli for 6 to 8 weeks. At the end of 3rd month, maximum 1% excrete the organisms, and at the end of 1 year, the average carrier rate is 3%. These are the some numbers. If you can remember, you remember. But if you don't remember, don't take tension. You just mention that gradually the carriers will stop excreting that Vibrio cholerae. In chronic carriers, the organisms stay in the gallbladder and biliary tract. Famous case is, I think, my dear friends, there is something wrong. There is something wrong. I'm extremely sorry. I'm extremely sorry. There is something, pages are not properly. So what to do? Just there is some problem of the pages that I am seeing here. So what I can do, because I don't know at the moment, I cannot, just hold on. I will try to pause the recording. Welcome back, my dear friends. I am very sorry. There was the cholera topic was end, and I could not make a continuous flow of that another disease. But yes, now I can ready with the new topic that is called as a typhoid. The cholera topic is already finished in the previous session. Now we will discuss about Santata Jwara or Vishama Jwara in Ayurveda. This is a type of fever, but it is a long-running fever. Usually normal flu or the viral fever, they ends in what you can say the 2, 3, 4, 5 days. But this typhoid can remain, for example, 1 week, 2 weeks, like that. So typhoid is a long running fever, and there is a specific test, blood test, which is called as a Vidal test. Write down typhoid Vidal, typhoid Vidal. Again, it is for AIPGET. This particular questions will be asked as a MCQ in the entrance examination. So Vidal test is specific for typhoid, but it is done only in the second week. Please try to understand. Only in the second week, then it comes positive. If you do after second day, after third day of the fever, it will not come positive. So try to understand. Typhoid Vidal test is done, is called as a titer, and second week. But then again, there is one problem. If you are already used a lot of antibiotics in the first week of the fever, then although that is a typhoid fever, the test will not be positive in the second week. So that is why it is recommended that whenever, unless and until it is specifically indicated, don't start antibiotic immediately on the first day, second day, third day. But many patients are anxious and doctor is also anxious, and they give the azithromycin. So this is not the correct policy. Actually, it is indicated according to Ayurveda, you can use Maha Sudarshana Ghanavati. Please write down. Maha Sudarshana Kadha is also available, liquid. Those who prefer liquid, they can take liquid. Those who want to engulf the tablet, Maha Sudarshana Ghanavati, 3 tablet morning, afternoon, evening. It is the best like paracetamol. It is best like paracetamol or crocin or a tablet Dolo. Dolo and crocin are the brand name, and paracetamol is a generic name. That is modern antipyretic, not antibiotic, antipyretic, Jvaragna, which will reduce the fever symptomatically. Similarly, in Ayurveda, Maha Sudarshana Ganavati is available. You can use it. Okay. Typhoid fever is a systemic infection caused by Salmonella typhi. Again, AIAPGET. These name of the organisms, incubation period, all these things are asked in entrance examination. So this is Salmonella typhi and found only in the human being, not in the animals. Patient suffers from typical continuous fever for 3 to 4 weeks. OMG, oh my God. Enteric fever. Another name is a enteric, related with your intestine. Enteric fever means typhoid and paratyphoid fevers. Disease occurs sporadically, epidemically, and endemically. Samsargajanya vyadhi, from one person to another person with the different resources. Okay. So let us discuss about this problem. Typhoid occurs not only in India, many parts of the world where water supplies and sanitation of poor quality. It is again a problem of developing the countries and not developed countries. mostly, okay, because it is related with the water, impure water, and sanitation, improved living conditions, and antibiotics. Antibiotic development in 1940s give the drastic reduction of the typhoid morbidity and mortality. Morbidity is a vaigunya, disability, different problems, and mortality, death, both are reduced. Since 1950, resistance of antibiotics is becoming a problem, because I fully remember when I was child, the best antibiotic for typhoid, you write down chloramphenicol capsule, chloramphenicol, CHLO, chloramphenicol was very popular for typhoid. But afterwards, when I was in the BMS course, medical college, that effect of the chloramphenicol has gone. The people are resistant to chloramphenicol. What is meant by resistant, sir? The chloramphenicol is not acting now. It will not reduce, it will not cure your typhoid. Typhoid is 100% curable. But now new generation antibiotics are coming into the market. Typhoid caused by multi-drug resistant, please write down this word, MDR, multi-drug resistant strains, S. typhi, are more dangerous and associated with severe illness and weakness. MDR, multi-drug resistance, S. typhi is resistance to all three first line of antibiotics. That means there will not be use of chloramphenicol. There will not be use of ampicillin. There will not be use of Bactrim, cotrimoxazole, Bactrim. No, you cannot use it. In India, typhoid fever is endemic. 1% of the children up to 30 years of age suffer from typhoid fever every year. See how much is the. Now, there is a prodromal stage. In the prodromal stage of typhoid, patient complains of malaise, headache, sore throat, abdominal pain, or constipation. In addition to fever, please write down these symptoms. I'm sorry. Epidemiological factors I have forget to mention. Salmonella typhi is a major cause of enteric fever. Then Salmonella para A and Salmonella para B are comparatively rare. Salmonella typhi has three main antigens, that is O, H, and VI. Infecting dose and virulence of the organisms decide the onset of typhoid fever. That means how severe infection is there, that will decide the prognosis of the disease. Man is the only reservoir patient or carrier is. They suffer from prodromal stage. Patient complains of malaise, headache, sore throat. These symptoms are important. You are requested to write it down because these cases are very common in our practice. Typhoid cases will be there. So, fever is there, but malaise, headache, sore throat, abdominal pain, or constipation. This is another important. Fever ascends step ladder fashion. 1, 2, 3, 4. That means first day it was only 99, then 99.5, then 100, then 100.5, then 101. Step by step, the fever will go on increasing, and that again AI-PGET step ladder fashion is a feature of typhoid. Step ladder fashion is a feature of typhoid fever. Within 7 to 10 days, the fever rash at highest level and fever reaches at highest, for example, 102 or 103 degrees Fahrenheit, and patient will look toxic, exhausted. In the early stage, marked constipation. Some people will suffer from constipation. Some people may suffer from pea soup diarrhea. So constipation is not for all. Fever with constipation or fever with diarrhea is also common in typhoid. This is for AI-PGET. Again, the same. I think I think there was some message. Okay. You can see. Okay. I think this problem has been solved. Okay. So let us see this, that what is happening. Marked abdominal distension is also present, and peripheral blood smear. This is important. Blood, like malaria, the typhoid also, you can do the peripheral blood smear, and then under microscope you will find that leukopenia is there. This is the difference. This is the difference. In normal bacterial fever, there is always leukocytosis, white blood cell. Leukocytes means white blood cell. These are the soldiers. That count is increasing in any fever, bacterial fever. Normal count, can you tell me normal count of leukocytes? 4 to 11,000 per cubic mm. 4 to 11,000, these are the WBC count, normal count. But when bacterial infection is there, in spite of 11,000, it can reach to 15,000. Mild infection. 20,000 per cubic mm, moderate infection. 30,000 per cubic mm, severe infection. Now, typhoid is also infection, but here there is totally opposite, leukopenia. So, in spite of 4 to 11,000, it will be 3.5 thousand. It can be 3,000, 3.8 thousand. So, less count is found in typhoid. This is a specialty of typhoid fever. So, MCQ, AI, PGET. Leukocytosis is common in bacterial fevers like urinary tract infection, pneumonia. But in typhoid, there is leukopenia. Okay. So you can also test the blood culture, urine culture and sensitivity. Stool culture is always positive for Salmonella typhi organisms. Without complication, if there is no complication, no bleeding, the patient can get cured in 10 days. Nothing to be worried, because it is 100% curable disease. Only we have to use the proper antibiotic. Now, in advanced cases, when the disease is little bit more severe, there is a splenomegaly. Very interesting finding. Typhoid fever, the symptoms are very specific. Pea soup diarrhea, typhoid. Step ladder like fashion, typhoid. Okay, so these are some leukopenia, typhoid. Similarly, splenomegaly is a specialty of typhoid fever, abdominal distension and tenderness, and the most important, my dear friends, relative bradycardia. I request, I will take pause, write down. Relative bradycardia, again AIA PGAT, entrance examination. Relative bradycardia is a feature of typhoid only. I will tell you what is that. For example, my normal temperature is 90 degrees Fahrenheit. Okay, normal. I'm okay, healthy, 98. And my pulse rate is, for example, 70. Normal, everything is normal. Now I have the fever, mild fever, 99. In spite of 98, I have the fever 99. Then pulse rate will increase from 70 to 80. Are you getting my point? Again, 99 to 100, my pulse rate will be 80 to 90. So as the fever increases, my pulse rate will increase. But this is not in typhoid. This is not in typhoid. Even if my fever is 102 degrees Fahrenheit, my pulse rate can be less, like 90 only. Are you getting my point? Bradycardia means less pulse. Tachycardia means excess. Usually, fever increases, pulse rate increases. Fever increases, pulse rate increases. But here, fever is increasing, but pulse rate is low. Fever is increasing, pulse rate is low. That is called as a relative bradycardia, is a typical feature of typhoid for entrance examination MCQ. Okay. Then dichrotic pulse are the typical features. Then there is a rose spots, pink color spots appear in the second week of the disease. The spots mainly found on the trunk are pink papule, 2 to 3 mm in diameter, and if we press it, pink color goes, that is fades away. Spots disappear in only 4 days. In 10% of the patient, serious complications may occur. Patient remains ill longer than 2 weeks. Intestinal hemorrhage, most important complication of typhoid, bleeding inside the abdomen. Intestinal hemorrhage is there, sudden drop in temperature and sign of shock. Sign of 3D pulse. Pulse. Patient is unconscious. Cold, clammy hands. Sweating is there. So that indicates the patient is having shock, hemorrhagic shock, because there is bleeding inside the abdomen. Okay. Now, immediately you can do the sonography and you will get the finding. In the 3rd week, intestinal perforation may occur. This is also important complication of typhoid. Inside abdominal bleeding or perforation, hole to the intestinal wall, hole. Okay. Less frequent complications means cholecystitis, inflammation of the gallbladder, inflammation of the kidney, that is nephritis, and sometimes mental disturbances, psychosis. Fatality rate, patient can die from 1 to 4%. If 100 people are suffering from typhoid, 1 person may die because of the complication. Okay. So proper diagnosis and proper antibiotic should be started immediately. Okay. So laboratory diagnosis. Definite diagnosis depends on the blood culture. You can do the blood culture, but it takes a long time to get the report. Okay. Salmonella typhi, sometimes stool culture may be helpful. Most important test I have already mentioned in the beginning, that is a Vidal test. Vidal test measures agglutinating antibody level against O and against H antigen. That is called as an antibody titer. How much antibodies are there in the blood? O antibodies appear on the 6th to 8th days. Remember these my words. It will not come positive in the 2nd or 3rd day of fever. Don't get confused. H antibodies will present in the blood sample only after 10 to 12 days. So the doctor and the patient should keep the patience. Should keep. आपको धीरज रखना है भैया, जल्दबाजी मत कीजिए. टाइफाइड का डायग्नोसिस ऐसा 2-3 दिन में नहीं होता. Sometimes I feel happy to speak in Hindi. That's why I'm speaking in Hindi. Test may be negative in 30% cases. New diagnostic test. This is very important. IDL Tubex. Please write down the name. In the practice, you will need this name. IDL Tubex test, marketed by a Swedish company, is available. This can, of course, blood test. This can detect IgM antibodies, 09 antibodies from the patient within a few minutes. Another, Typhoid dot test. Please write down both the names. Typhoid dot test takes 3 hours to perform. Immediate result. Vidal test is now outdated test sometimes. Still, it has its own importance. But in addition or in spite of Vidal test, you can perform this Typhoid dot test. It is developed in Malaysia for the detection of specific IgM and IgG antibodies against 50 kD antigen of Salmonella typhi. Typhi.m is recently developed. Specific test is there to detect specific IgM antibodies only. Typhi.m. Please write down the name. Typhi.m test is available in pathological laboratories. Now we will go further. Control of typhoid. How you can control the typhoid? So this is done by control of reservoir, control of sanitation, and control by immunization, vaccines. For control of reservoir, early diagnosis with cultural blood, you can do the patient's blood culture or patient's stool culture, it is important. Number two, notification. The private practitioner should inform to the local corporation. See, I have this patient and having this typhoid. So isolation, the patient should be kept isolated in the house. I'm not saying in the hospital. Patient should be isolated till 3 negative stool samples are available. Okay. Okay. Now we are at the last part of the typhoid discussion. Can you see over here? Okay. We are talking about now medicines. Okay. Liquid vaccine is used from the age of 2 years. Both types of vaccines are given in 3-dose regimen, that is first, third, and fifth day. Protective immunity is achieved 7 days after the last dose. It is better to repeat the series every after 3 weeks. Now, proguanil and antibacterial drugs should be stopped before and after 3 days of the vaccination days. Also, vaccine is ineffective if the person is having diarrhea. Vaccine is not recommended in immunodeficiency state with immunosuppressive and antimicrobial drugs. Even vaccine should not be given in the acute febrile illness. If the what you can say, the very much fever is there, don't give this particular vaccination. Okay. So we are still talking about the typhoid, and for that, in addition to these notes, I would like to give something more to you by just discussion about the typhoid fever. But I think you have a little bit understood, okay, about this typhoid fever. It is a long running fever. We have understood the clinical features, okay, and we have also seen that the different, what you can say, the vaccines are available, because here we don't give much importance to the medical treatment because this is a subject of Swasthavritta. Okay. So lab diagnosis we have seen, how we can do control of the typhoid also we have seen. And for example, patient should be isolated for 3 negative stools that we have seen. And the treatment, what is the treatment? So please write down. Consists of fluoroquinolone. That is better way I will give the simple name. Ofloxacin. Will you please write down the treatment? I am talking about typhoid treatment. Ofloxacin is an antibiotic. Ofloxacin. OFLOXACIN. Or ciprofloxacin or ciprofloxacin. Ofloxacin or ciprofloxacin. 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 What is the dose? Please write down the dose of typhoid antibiotic. 15 milligram per kg for 7 days. For 7 days. Now I am going further. I repeat, which is not seen in this particular notes. That's why Dr. Deshpande is telling to or dictating the notes. Dr. Deshpande is talking about typhoid antibiotic. Which antibiotic you can prescribe? Number one, ofloxacin or ciprofloxacin. What is the dose? I request, please write down because it is not there. So you have to write down by your own hand. Ofloxacin, OFLOXACIN, or ciprofloxacin, CIPROFLOXACIN. Ciprofloxacin dose is 15 milligram slash per kg for 7 days. Now I will ask one question. You have to answer me in the comment box. What can be the dose for a adult having 60 kg weight? 60 kg weight. So what you have to do? 60 multiplied by 15. You do it by yourself and give me the answer in the comment box. How you can give the dose. For example, ciprofloxacin tablet of 500 milligram. How many times you will give that particular tablet? Some patients are there who are having a drug resistance. For them, there is another higher antibiotic, fourth generation antibiotic. Please write down the name. Cefixime. 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 Cefixime for 7 to 14 days. Cefixime is an antibiotic. Okay. Now, there are some people who are still having quinolone resistance. Quinolone is a group of pharmaceutical drugs. Then we can give azithromycin, very famous antibiotic, AZ500, azithromycin or ceftriaxone. Ceftriaxone can be used. Azithromycin or ceftriaxone can be used. And whenever the patient is very serious and very toxic, you can use steroid. You can use to prevent the life of prevention of the death. Prevention of the death. To keep the patient alive, you can use the steroid, that is injection hydrocortisone. Injection hydrocortisone 100 milligram per day for 5 days. Okay. Now, stools and urine are the only source of infection. So, these stools of the patient or urine may be disinfected by 5% cresol. This is anti-infective solution for at least 2 hours. Nurses and doctors should always disinfect their hands. Follow-up examination of stool and urine is done for Salmonella typhi after 4 months from the discharge date and again after 12 months to prevent the carrier state. Now I have explained the treatment as well as prevention. Salmonella, these typhi organisms can remain in biliary tract, bile tract, liver and gallbladder in the carriers. The VI antibodies are present in 80% of the chronic carriers. These carriers people should also be given antibiotic. And that antibiotics is amoxicillin, AMOXY, amoxicillin 4 to 6 gram per day. Plus another medicine, probenecid. Can you write down? PROBENCID. Probenecid 2 gram per day. First is amoxicillin 4 to 6 gram per day with probenecid, PROBENCID, probenecid 2 gram per day for 6 weeks. These drugs are concentrated in bile and remove the carrier state. Carriers always should be kept under surveillance, under observation. They should not be allowed, these carrier people, if they are working in the hotels, they should not be allowed to carry or to handle the food, to handle the milk, to handle the water and other things. Health education about the washing of the hands with soap after disinfection of urination and before preparing the food is important. So these are all the measures we should take. Control of sanitation is done by the protection and purification of drinking water. Improvement in the basic sanitation and promotion for the food hygiene. Immunization is the only specific preventive measure. Prevention is better than cure. You must do the typhoid vaccination. Okay, it can be given at any age more than 2 years. Child below 2 years, not necessary. Anti-typhoid vaccines are available. Please write down. typhoid vaccines. Number one, the VI polysaccharide vaccine. VI polysaccharide vaccine. VI polysaccharide vaccine. This was first licensed in the USA in 1994, was given intramuscular or subcutaneous. This is injection. VI polysaccharide vaccine for typhoid. Dose is 25 gram of the antigen. Then vaccine C is stable for 6 months at 37 degrees centigrade and for 2 years with 22 degrees centigrade. Storage temperature is 2 to 8. Only one dose of vaccine is required. Protection that from the typhoid starts after 7 days. To maintain the protection, revaccination may be done. Again and again vaccination every after 3 years. Repeat the vaccine. Okay. The vaccine can be given with another vaccine like yellow fever vaccine or hepatitis vaccine. It can be combined together. To international travelers, this particular vaccine is very important because no serious adverse effects or no specific contraindication are there for this VI polysaccharide vaccine, typhoid vaccine. Number two, second vaccine, the TY21, T capital, Y small, TY21 by A vaccine. This was first licensed in Europe in 1983 and USA in 1989. This is orally administered, live, attenuated TY2 strain of S. typhi, available in enteric coated capsule also or liquid suspension to drink. Liquid formulation, here you can see, consists of vaccine liquid. We are talking about TY21, TY21A vaccine. It is provided in a sachet and a buffer in another, which are combined with water before use. Here you can see capsule can be used for age group more than 5 years. Liquid vaccine is used for the age group of 2 years. Both types of vaccine are given in 3-dose regimen, first, third, and fifth. Protective immunity is achieved 7 days after the last dose. It is better to repeat the series every after 3 years. Then progunal and antibacterial drug should be stopped before giving this vaccination. I think about this vaccination we have talked a lot. I am very sorry that in this lecture there was some missing points in the notes, but I have tried to explain all this to you in a very proper manner. So at the last, in 1 minute, if anybody wants to write down the proper antibiotic, different antibiotics for the typhoid, I will repeat. First generation antibiotic is ofloxacin or ciprofloxacin, 15 milligram per kg for 7 days. Number two, for resistance cases, cefixime, CEFIXIME, cefixime for 7 to 14 days. If the patients are still resistant, you can use capsule or tablet azi or azithromycin or ceftriaxone. You can use it. And in serious patients in the hospital, injection hydrocortisone 100 milligram per day is given for 5 days. My dear friend, today's discussion was epidemiology of the cholera, loose motions, and where oral rehydration is most important. And in the typhoid cases, there are the different interesting features that you must remember while studying this typhoid. Okay. This is the end of today's lecture, and we will meet for the Charak Uttarardha, Charak Chikitsa Sthan. We will discuss Jwara Chikitsa, and we will start this journey. It is not a very easy or short topic. It is a long topic. We can make 1 or 2 sessions for Jwara Charak Uttarardha. Thank you very much. Take care and see you in the next session. All the best.